Good afternoon, all. Sorry I was a little late. I was wandering the building. I'm just going to breeze through this stuff very quickly. I'm going to probably have a little bit of overlap about some of the things that Dave asked, but I just want to start with this kind of trick question. Does anybody know what that building is? Anybody? I didn't expect you would. This is the hospital for the city of Venice in Italy. That's the front door from the 15th century. This is the lobby, the front lobby, and then inside there are several garden courtyards, the kind of things you would see in a monastery or a convent or a cathedral. And everyone in their path of travel through the front door, there are other ways into the hospital, of course, goes by those gardens. That's a group of people just headed into some of the wards or towards the ER, wherever they're headed. And that garden is heavily used because it's just a beautiful place of respite that staff, patients, family members can go to every day. It's so simple and so basic, and it's 600 years old or 500 years old. But it really talks to the principles, which was back in the day, healthcare was such a special, sacred thing. You were so fortunate if healthcare could help you. Therefore it had such an esteemed place in our community that they were built in the best buildings. They were the landmarks. They were the more important looking, more beautiful than the City Hall, because people understood back then how important healthcare was and how sacred it was that you had an ability for healthcare to make your lives better. And that's the kind of place you see, and you see it time and again. On the left, that's a closed building. If you're ever down in Buffalo, you can get a tour every once in a while. That's the 100-year-old, 130-year-old Buffalo State Psychiatric Hospital. It was built as a gorgeous Victorian building. It's a little Addams Family-like looking now, but if you can see better photos of it, it's actually quite lovely. The interior, there's all sorts of beautiful brick detailing that had copper and slate roofs. It had all this elaborate detail because, again, it goes back to that basic principle that was captured in the quote from Churchill: buildings affect us. Buildings change our lives. Buildings mold us. And it really does make a difference, whether it's in healing or whether it's in just quality of day-to-day life. Similarly, the Royal Victoria Hospital in Montreal, you don't see buildings like that being built these days. And then we see a more contemporary building, and it's not fair to pick on St. Joe's because it's been a bit of a hodgepodge of additions. But again, what's missing there is a vision and a sense of trying to capture the essence of those other traditional buildings. And for those of you who are students, you are headed off into a long career ahead of you. For most of you, you have 40 years of work life ahead of you. Where would you want to spend your work life? Because that is fully 1/3 of your entire future is going to be spent somewhere. You better spend it in a nice place rather than in a hellhole, because it will impact your life. It will impact your personal life. It will impact your health. It will impact your mental well-being. Other facilities, just to mention a couple of good ones, and perhaps one that I'll pick on again. The top ones are the Center for Addiction and Mental Health on Queen West, the replacement for a horrible concrete brick bunker, monolithic, big, gray, dull, ugly building. There's plenty of them around. That's what they replaced it with. And the concept there is a village of healthcare, a series of beautiful little buildings mixed in with condos, mixed in with commercial. And it's a totally different vision for what a healthcare facility could look like. On the other hand, we have a construction shot of what St. Joe's is building up at West 5th and Fennel right this moment. And to me, it's a huge backward step, because we're not creating a building that's healthy and happy. One of the most important principles of life is that nobody wants to spend their time in an institution. Institutions are bad. The word clinical may be beautiful to you, but to the rest of us civilians out there, clinical is a dirty, dirty word. Institutions are not welcoming. There's all the terrible connotations of that term. If any of you have seen the movie Brazil, you get these sort of senses of foreboding, gloomy buildings that don't connect us with the natural world and that don't make our lives richer and better. In fact, they go the other way, which kind of disassociates us. This is a first-rate nursing unit, probably from 1910, I think it is. Back in the day, again, back to that principle that if you could get health care at all and it could make your lives better, that was a great benchmark. But the world has changed quite a bit. Now we understand that in a unit like that, infection is much more common. But that, at the time, was considered state of the art. So keep that in mind as we move forward, where things have come and gone. I'm just going to throw some quick examples of other things that are going on out in the world just to, to throw some curveballs at you. Some of you may have experienced great spaces and great places to work in your career so far. Some of you will and some of you won't, but at least you should know that they're out there. And when you get, the lesson I think from David and I is, when you get to that point where you have an influence, which is soon, start demanding excellence. This is a sexual health clinic. Again, sort of like a primary health clinic in BC. This is some examples of VIP hospital room coming from the US, where of course dollars drive things, but it's the principle again, that you can make things beautiful. A dental clinic where there's a lot more thought and attention in the private sector than in the public sector, and that's a big problem because you're destined to work in the public sector here, like it or not. These are not the greatest photos, unfortunately, but the bottom one shows the McMaster Family Clinic, which is at Main and Macklin in an old converted bowling alley. And at top, what we did was Stone Church Family Health Center, which was very much a compromise in many ways because it was a renovation of a drive-in State Farm Claims Center, whatever it was. And we have real constraints on budgets. Nothing's unlimited like in the States. But in McMaster Family Clinic, everything's stainless steel. The windows are shuttered. The tiles are beige. The walls are beige. The ceiling is beige, not unlike this room. And the furniture is, you sit out in the open, and then you end up sitting in a relationship with people you don't know where you're doing this, and you're forced to. It's one thing to sit with your friends like this, where you're having a conversation with people you know and you like. But if you're feeling vulnerable, if you're feeling ill, if you're not feeling very good about yourself, the last thing you want to do is have these kind of relationships forced upon you. And a very common thing is to have a very horrible institutional waiting room. Our model for Stone Church is looking elsewhere outside of healthcare. So we look to and Stone Church is a primary care clinic. It's not a hospital with a ward per se or patient rooms. But the models that we look to are the only other place I'd ever want to stay other than my house. A hotel or hospitality. We look to those models. If you're not at home, you want to be at a nice restaurant, you want to be in a hotel lobby, you want to be in a hotel room. Look at those places. And if you've got another example, I'm open to it. But look at those places for ideas in terms of what healthcare should look and feel like today, because that's the answer. So, the hotel lobby, Stone Church, on the right, you can't see it, but that big box is a glass fireplace. The left box is a fish tank that David mentioned that's down at a low level so kids can get at it. And it is, it's just a magnificent sort of draw for kids. Glass where we could put it, looking into a garden with bird feeders, not natural light, and the waiting room is broken up into pods with those wood slats that you don't really see as well in the photo as you might. At the reception desk, it's broken into stalls, like you might get at a hotel desk when you're checking in. So you have some privacy. So when I'm up there talking about why I'm there checking in to get my chlamydia fixed, and you're here doing something else. You want to have some dignity and privacy, because none of us are there with other people like I said, we're not out with our friends. And it's the same in hotel room, or the difference between a hotel room and a patient room. It's important that we give people dignity and carry that through in their lives. The exam room shots, the old Stone Church, very simple, very clinical, very bare. The new ones don't read so well, but we've got wood look floors. They're not wood floors, but they're wood look vinyl, a little bit warmer and richer, better colors, wood doors, variable lighting, softer, darker rooms that you can turn into a proper clinical exam room when you need to. Very simple lessons, but it requires thought. Stone Church original hallway on the left, all sorts of gewgaws and things hanging off the walls, garbage bags, plastic gloves, very clinical and institutional, not very warm and welcoming. Stone Church on the right, again, you can't see it very well with this bad slide of mine, but carpet on the floors, a little bit richer, accent lighting, windows at the end of the hallway looking into a landscaped area with a little bit of relief, and just a little bit quieter, art on the walls, things that just kind of can make it richer. Other examples, back to the birthing room, the original delivery room, very institutional. There was a time until about the 90s, the 80s, where we thought that if we showed off technology and we made everything shiny and stainless and metal, that the technology would make us feel comfortable and warm and reassured. That would be the model for the St. Joe's East End Community Health Center, a very slick metal building, and somewhat for the existing St. Joe's. doesn't resonate with people. It doesn't make it feel warm and soft. It's almost like, you know, you have to go back to those hospitality models. But the new birthing rooms that are out there that people are building in the States, you notice they're darker, they're richer, they're softer. Other sort of clinical examples you notice in all of these: big windows, high ceilings, color, richness. These do not look like the hospital spaces that most of you have probably experienced. So it can be done. It's being done all over the place. There's lots of great examples. You have to demand to have that done here as well. This is a student university medical center on campus. Just been done. Very nice little thing. Beautiful space, outdoor porch, great to hang out. This is probably a little over the top, but it shows where the sort of mentality of some people are. That is a hospital, not a Rocky Mountain ski resort, but that's what it's modeled on, and it's in Colorado. It's not my aesthetic, but it gives you, again, the sense of what a patient room could look like with a fireplace. I'm sure you pay handsomely for that privilege, and the lobby with the grand fireplace. But it's just taking the gestures and the examples from there to learn from. I think that was really it. I was going to maybe throw out a couple more stats. Is that my notes? Where did I drop those? I dropped them somewhere. There they are, on the blackboard. There were a couple other stats I wanted to throw out, sort of in addition to David's, just to kind of bring it home. There's very little architectural research done, and that's a huge problem. Unlike the world that you live in, and maybe you should demand that change. The bit that's done is called the evidence-based design research, and they do go out and do a little bit of stuff, but not a whole lot, unfortunately. There's some good things out there. There's the Pebble Project. There's the Center for Health Design. Here are just a couple of, I just want to glaze over it. Single rooms lead to better outcomes. I think probably that would be pretty evident. You have lower infection rates, you have shorter stays, there's less noise and more privacy, and hence better sleep. There's less transfers, less medical errors, and much less stress for the patients. That means they go home sooner. They did a study where they found that if you just had a view of trees in your room, you had a shorter stay, you took 22% less pain medication, and you were in and out a day or two earlier than anyone else. In a new hospital in Michigan with all private rooms, rate of infection is 11% lower than it was in their old building. An infection can add 2 weeks to a hospital stay, and each year the cost of hospital-related infections in the US is $4.5 billion. And you can just extrapolate it to here at a tenth the size country, it's still a significant thing. Every patient that falls, $10,000. So if we can find a way to make the bathrooms closer to the bed, if we can find the aids, like the pads that automatically generate an alarm when they leave, little things like that, that can stop 80% of the falls. Patient falls in the US, they're projecting are 20 billion last year, headed up to 32 billion by 2020. In another quick study, they said that nurses spend 30% of their time walking. If we can make our buildings more efficient, more effective, and you can just extrapolate that for every other clinician. So much time is just spent moving. If we can make it more efficient, there's a huge cost savings. Medical errors and hospital-acquired infections are among the leading causes of death in the US. They each kill more Americans than AIDS, breast cancer, or automobile accidents. So again, if we can reduce those through design, we're going to be far ahead of the curve. And in a hospital, 60 to 75% of hospital costs are labor. So anything we can do to make labor more efficient, we talked about the sick days, is huge. In addition to the building design and aesthetics for the patients, I just want to throw something out for you to think about. Work life, quality of work life. I don't know if that's something that's on your radar screen yet, but back to the notion that you're going to spend a vast amount of your time in working in a facility. The quality of the facility will enhance your life. If it's a good facility, you will have better interaction with your colleagues. You'll learn more. If it fosters informal communication and learning, you'll build more camaraderie. You'll build a better sense of teamwork, which means you may have more or less hesitation to talk to someone about a problem or about something you don't understand, which might make you a better clinician. You may have a more likelihood to open up about a problem if you have better access to other people and if you feel that the environment is very reassuring and comforting and not threatening to you. If we look at that beyond the basics of your quality of life and that you're happier and healthier, many facilities like that will help with retention, will help with recruitment. So it helps, we're always talking about the need to get the best of the best, and and always this fear that there's the allure of the US. If we have better facilities here that lead to a better work life, we're going to help retain and recruit the best people, and it makes a difference. And these are all hidden things that are not evident to you necessarily at a blush. The other thing that's happening is the patient experience is changing. We have to be more holistic in the way we look at it. Up until a few decades ago, it was very much the doctor knew best, the patient sat there dumbly and just did whatever was happening. The world's changing and people are much more engaged. And also people are changing. We've become much more diverse. Look at the room and look at all of you. Ethnically, religion, customs, traditions. It's a very eclectic world we live in. And we have to accommodate for those changes. And it's the same whether you're a clinician or whether you're a patient. A big part of facilities is about privacy. Noise is stress. And about the quality of healing, the environment really feeds into it. And David talked a little bit about it with his own experience. I'm also, what informs my design work is I'm also a patient. I had the beautiful fortune to spend a night in the Henderson ER a couple of years ago. That was my first hospital stay in my life, and it was a real eye-opener. And then I went to surgery for a mild skydiving accident, and then I had the follow-up. I have a family doctor. I have a dentist. I experience the medical system. I have friends and family who've gone through it, who've been patients, who've passed away in hospitals. If none of you have spent, or if some of you haven't spent a night in a hospital, you really need to, because it will change your experience. And one of the most important things is about privacy and about noise and stress and how they all come together to affect well-being. If you're stressed out, if you're tired, if you're agitated, if you don't feel very good, you feel vulnerable, it will affect the quality of your care and the quality of your interaction with your clinicians. So I think, just to kind of wrap it up, the things we're trying to talk about is we need to deinstitutionalize the healthcare experience. We need to build a quality workplace. We need to think about the intrinsic benefits. What we always hear is it costs 10 to 15% more to build a great hospital over a basic, bare bones, bland one. But I think what we're trying to argue is the savings are there, and perhaps even beyond that in other ways. So the sort of call to all of you as the next generation of healthcare leaders is, when you get to that position, you need to start agitating, and you need to start holding your bosses, your administrators, whoever's making the decision, you need to hold them accountable for producing quality, and you need to agitate towards getting that.
So, just a couple things just to add to that, and then we'll open it up for questions and discussion. How many of you have relatives with Alzheimer's or severe dementia? Okay, so some of you have experienced that. And what you experience is a loss of ability to recognize familiarity, recognize individuals, recognize their location. One of the design principles now around hospital and other facilities, for example, is to make it in a circular type ward. So now we have rectangular wards and grid-like patterns. Instead, for those individuals with dementia, it's quite clear that building a ward in a circular fashion means that the patients tend to walk in a circular fashion, and they go around and around, and lo and behold, they find something that's familiar in their room. Their nameplate, which is now in large font as opposed to the tiny little font that only individuals that are under 40 can read, so you make it in the large font. You have pictures of their family and their children on the walls. You put a favorite thing in the little glass
Display case.
display case outside their room. And that's just such a simple design thing, and it means what happens? They have less patients going AWOL, they have less agitation because the patients can find their way home to their own room, etc., but they're still able to do the circle. That's one trivial example of a design thing that makes an enormous difference both to the patients, to cost, etc. This building, for example, was state-of-the-art in the 1970s, I guess, when it was built, and it was designed with a number of design principles that made a lot of sense. The one that I think probably drives all of us crazy is you have to take elevators everywhere, unless you've been here for enough years that you know the ins and outs to take some of the back stairs, but you still can't get to the parking lot unless you take an elevator, right? And we know there was a study that was just published, I think in the New England Journal, that said it was if you took 20 flights of stairs per week, you reduced your risk of a stroke per year as you get older by something like 10%. Huge numbers. And it's just so evident that it's part of the design. So we're designing the new downtown family health center across from City Hall. One of the principles we've put in is wide stairs. We're putting in walking meeting room. What's a walking meeting room? A meeting room that's big enough that we can walk on a treadmill while we're having a meeting. Instead of the classic thing of sitting around a table, we can actually walk. We've put in internal circuits on each floor such that you can walk on the floor in terms of the whole perimeter of the building and still see out to green. We've put in trees outside a lot of the windows so that you can constantly see the green, trying to bring in the concept that it's not only about the folks that we're providing care for, but it's about the employees that are working within that environment. So as I think Bill and I tried to paint a picture here, is the design makes a huge difference not only to you as a patient, but you as a healthcare provider, as well as administrators and all the other individuals that are involved in it. And that's why places like Google, et cetera, are working hard to create livable environments. And it's not just the square box building. So, Bill, thank you for joining us. Sure. And we'll be pleased to answer any questions.